Creighton EMS 440 EMS educator Dan Stein coming at you live from Orange County, California. Today we're here with Fountain Valley Ambulance 31, my old stomping ground. Zach Edwards has been kind enough to demonstrate how to use a glucometer, when to use it, why we use it in a pre-hospital setting as EMS personnel. So before we get going, Zach, thanks for taking the time to show my EMS class.
Anytime, we're happy to be here, happy to help out.
How to demonstrate the skill. What's your background in EMS? How'd you get here?
I actually recently just celebrated 6 years working for Care Ambulance out here in Orange County and LA County. I have a background in emergency medical care, got my bachelor's degree, and looking forward to many years of service in the pre-hospital setting.
High five on that
yes.
one. Yeah, buddy. All right. So today we're going to talk about glucometers and why we use them. But first, before we get to that, let's quickly have a little anatomy, physiology refresher here. So we're talking about the pancreas, and the pancreas is an endocrine and an exocrine excreting hormone, and the system located in both the upper and right quadrant of your abdomen. And so what they do, we're going to talk mostly tonight about the endocrine side, not the exocrine side. We have three cells that come out: the alpha cells, the beta cells, and the delta cells. The alpha cells secrete glucagon, which is a hormone that gets released out into the blood when the blood sugar is low. It sends a message to the liver to release glucagon releases glycogen, and glycogen converts the stored sugars in your body in the liver into sugar to glucose, and the glucose is what your body uses to convert
energy.
Metabolically convert, energy. So what we're going to do here is when we pull out the glucometer, we're basically looking for blood sugars. But so that's the alpha cell in the pancreas, and the beta cells it pulls out insulin. So what does insulin do, Zach?
Insulin, layman's terms, it more or less helps us digest the glucose. It helps us use the glucose for energy.
So the best way I learned what insulin did was on Dr. Oz about 10 years ago, right when he was first coming out. He had a show, and he said basically the insulin, it opens up your cells and lets that sugar from the blood get into cells to be used, to be metabolically processed, to use as energy. What happens is if you don't have enough insulin, those cells won't open up, sugar doesn't dump in, so it just sits around floating around the bloodstream, getting thick and gooey, and there's no way to convert that into energy. And so we see two different types of people who have issues with diabetes, and we want to check the blood sugar as they're hypoglycemics and hyperglycemics, but that's more of a sign and symptom associated with diabetes. Hypoglycemic patients, what do you normally see when you see those, when you roll up on scene?
You know, most of the time, whenever we see a hypoglycemic patient, you know, they'll, actually most of the times, they'll usually be unconscious. They'll be sweaty. You know, you'll notice they'll usually be in bed. You know, their entire sheets, their pajamas, everything will be really wet. Maybe a little cool, a little moist, and among many other things. You know, they'll be lethargic. Sometimes they'll be combative. You know, there's usually in that area is a lot of the stuff that we see. Typically,
yeah. Then the other side is your hyperglycemic patient, and for the majority, you don't see that in a pre-hospital setting because the onset's not instantly or pretty quickly with a hypoglycemic patient. With a hyperglycemic patient, the onset takes about 2, 3, 4 days to get going to really build that blood sugar up in the blood. So typically in a pre-hospital setting, we're dealing a lot with the hypoglycemic patients. So in diabetes, there's a type 1 and a type 2. And the type 1 diabetic traditionally used to be called the juvenile diabetes. A lot of the textbooks are getting away from that, but basically what a type 1 diabetic has is their insulin doesn't produce, their pancreas does not produce any insulin. So they need to have an injection done daily after they eat to put insulin in their body so they can be able to drop that blood sugar down. But the concern with those type of patients is if you take your insulin, let's say in the morning, and then you get going and they're a family and they have kids and they don't eat, now what happens? The blood sugar drops, insulin takes over, they get lethargic, unresponsive, call 911, and that's where we show up. So again, the type 1 diabetic, you're going to see they're going to be insulin dependent. Now a type 2 diabetic is 90% of the diabetics in America. Usually it's a lifestyle problem. We see it later on in life, usually due to diet, activity, genetic disposition. So those are the kind of people we're looking for, that we get a lot in the EMS, but there are two to be aware of, and so it's good to know the type 1 and the type 2, and what kind of medications they're on. Again, the type 2 diabetic can still maybe produce insulin, but maybe not enough, so they'll have to take a pill. Metformin's a pretty common one we see, and that's going to stimulate that pancreas to either secrete more insulin so it can perform the duty of getting that sugar into the cells. So real quickly, we're going to quickly demonstrate how to use a glucometer. And the glucometer's pretty simple, easy skill to use. We do it a lot in the pre-hospital setting, not only for diabetics, but really anybody altered, unresponsive, something's kind of not going on, we take a blood sugar, right?
Absolutely.
People sometimes say it's not a vital sign. I think with a kid who has a broken leg, you're not going to take a blood sugar on, but there's definitely an important time and a place when we want to take blood sugar. So Zach's kind enough here to going to kind of demonstrate the skill for us.
Absolutely. Like in any other thing we do in EMS, most important thing is our BSI, body substance isolation. Usually you're safe with with your gloves, but in this instance, I'm going to go ahead and throw on some goggles as well, seeing how we are going to be making some contact with some bodily fluids. Just like Dan said, while some people would consider it another vital sign just because we do it so much, you're going to be looking for all the signs and symptoms. You're going to be looking for that weakness. And so in this case, there are going to be so many different types of glucometer. In this instance, we use the Precision Extra. Make sure, of course, before you use this, you're familiar with this brand. You're familiar with how to use it. This is one of the other reasons why we're going to go ahead and do this. Dan's going to be my patient tonight. Along with familiarizing yourself with the glucometer, it's important to calibrate it. Your glucometer and your glucometer strips will come with a calibrator, and as you go through your specific packs, you'll notice that these numbers match, and calibrating your glucometer and making sure they match is a smart way of ensuring that you're going to get the correct results every time you check a patient's blood sugar. Dan's our patient. Whether he's conscious or not really doesn't matter. We're going to do it anyways. First, like I said, we have our BSI and our scene safety. We're going to go ahead and prep the site for a little bit of blood extraction. I personally like to use the side of one of the forefingers or even the middle fingers, making sure, using a little alcohol prep pad, making sure it's nice and dry as to not influence the results of the test negatively. Just like the number of glucometers differ, you're going to see so many different types of lancets. In this case, this type of lancet actually is spring-loaded. You remove this, and then you have your little sugar here on the back. So now that your site's prepped and clean and sterile, you're ready to go. So,
now, Zach, for me, sometimes I get really cold fingertips living in Nebraska, and I see that my fingers get really white. Do you ever have trouble sometimes taking blood out of the fingertips?
Absolutely. There are times when, exactly in that situation, you look at a patient, you feel a patient, you're going to notice that, hey, it's going to be really difficult to try and get blood out of this individual's finger. There are times where you do, after poking someone, you may have to lower their arms, underneath, their heart, and do all you can to get some blood out. A lot of the times after a paramedic has started an IV, there is some residual blood in his IV, in his needle, and we'll use that a lot of times.
You've had to knead it sometimes or squeeze
absolutely, a lot of times.
How about people who are on heparin or blood thinner? Do you ever see any complications?
Do you know what? That can be a little tricky. You just have to. It's all about preparations. About having the right. Maybe having a couple extra 4x4s just in case things get a little bit out of hand. But to be honest, you know, the size of the hole is so small, I've never had a problem with someone bleeding out from testing their blood sugar.
Awesome.
So hopefully that never happens. So like, as you can see, we have everything ready. The site is prepped. We have our test strip ready to go. And with this specific glucometer, you don't have to turn it on. Just by putting in the test strip and having that ready, turns on the glucometer. So I'm going to go ahead and give Dan a little poke here. It's always nice to advise the patient that they're going to feel a little bit of pressure. Just meet here on the side, put a little pressure down on his finger, and the Lancet's going to do the rest.
So now where do we want to put that before we do anything else?
You're just going to do a little pressure. Yeah, before we do anything else, we'd like to take the Lancet and go ahead and put it in the sharps. Now, with the site here, it's always good to remove this first drop. Use your alcohol swipe again, just so you get a fresh drop of blood there. It's going to come out, and you'll hear a little noise. Like I said, every glucometer is different. Then we actually have...
So this one's counting down from 20 seconds. Is that usually the time it takes for us to get a blood sugar?
For this one, you'll see other glucometers where, you know, it's immediate, but this one, that's usually the amount of time that it takes.
Now, a normal range for a blood sugar when you get it back, what are you looking for?
We're usually looking for as low as 80, and as high at, you know, mid 200s to the 300. I think is kind of the normal range. Anything lower than 80 will usually take steps necessary to bring that blood sugar up, whether it be through the administration of dextrose or some type of glucola. We don't necessarily treat hyperglycemia in the field with any type of medication or whatever it may be. We just, you know, rapid transport to the hospital.
For testing purposes, we want to look for the number around 70 to 100. I remember about a couple years ago, we were at 60 to 100, and then Orange County changed it up to 80. Like Zach said, there's a lot of people who live their lives with a high blood sugar.
Sure.
It's not good, but it's normal to them. So we see that a lot. But if they're not exhibiting signs and symptoms of deep breathing or they're unresponsive, it's good maybe to start some IV fluid to thin out their blood, depending if their lung sounds are clear. But again, you really want to find out what your local protocol says. Ours changes quite frequently. Sometimes I wake up in the morning, my blood sugar is at 65, but that technically means I would have to go to the hospital and get some sugar, but, you know, it's very, you just kind of got to look at more of the signs and symptoms, what's going on with the patient, why we're here, when we look at that number as well. Another thing I saw a lot when we were working together was we'd get people who were diabetic, they're unresponsive, but then we take their blood sugar and they would be about 100, but then we'd find out later that normally they'd be about 300. And so just because the number is in a normal range or above the normal range, they could be used to this higher level of of sugar in their bloodstream, and so you drop it down and they could still be exhibiting effects of hypoglycemia because of what they're used to in their body.
Absolutely.
Yeah.
And just like you saw, you know, discarding the test strip in the proper way and all your other materials that you've used in the proper way is another important thing about keeping the scene clean, keeping the scene safe. That's about it. I can't think of anything else.
Well, Zach, I appreciate you taking your time out of your shift and showing us how to demonstrate a glucometer. Appreciate it, and the folks back at home, appreciate your time. Thank you.
You're welcome.
Cut!